Can AFP blood markers show liver cancer response? Imagine trying to see how well a treatment is working without needing to do invasive procedures. That's where blood markers like alpha-fetoprotein, or AFP, come into play. AFP is a protein normally made by the liver and the yolk sac during early development. In healthy adults, AFP levels are very low. But when liver cancer, especially hepatocellular carcinoma, is present, AFP levels often rise. Doctors use AFP as a tool to help diagnose liver cancer, but it's also useful for monitoring how the disease responds to treatment. When a person undergoes treatment for liver cancer, such as surgery, targeted therapy, or other methods, doctors often check AFP levels over time. If the treatment is effective, AFP levels tend to decrease. This decline can suggest that the tumor is shrinking or that the cancer is less active. Conversely, if AFP levels stay the same or increase, it might mean the cancer is not responding well or could be recurring. So, tracking AFP provides a way to see how the cancer is doing without repeated imaging or invasive procedures. However, AFP is not perfect. Elevated AFP levels can occur in other liver conditions like cirrhosis or chronic hepatitis, which can make interpretation tricky. Also, some liver cancers do not produce much AFP at all, so a normal AFP level does not always mean there is no cancer. To improve accuracy, researchers have identified AFP variants, such as AFP-L3, which are more specific to liver cancer. The ratio of AFP-L3 to total AFP can help distinguish cancer from other liver diseases. A higher ratio, above 10%, is more suggestive of liver cancer. While AFP can be a helpful marker, it should not be used alone. It is part of a broader diagnostic approach that includes imaging tests like ultrasound, CT scans, or MRI, and other blood tests. The sensitivity and specificity of AFP vary depending on the individual and the testing methods used. Therefore, healthcare providers interpret AFP levels alongside other clinical information to make the best decisions. In summary, AFP blood markers can indeed show how liver cancer responds to treatment by tracking changes in AFP levels over time. A decreasing AFP usually indicates a positive response, while rising levels might signal the need for further evaluation. But because AFP has limitations, it's important to use it as part of a comprehensive assessment. Always consult with healthcare professionals to understand what your AFP results mean in your specific situation, and remember that each person's experience with liver cancer is unique.